Hello, everyone. Welcome to our live session today. I'm going to be going over a quick startup presentation and welcome you all to the program. If you guys have been here before, you've probably seen this presentation and repeatedly. If you haven't, then you're in for a little treat and welcome to our program. So we are an international student-led, minority-led, I don't know about women-led anymore, nonprofit for medical advancement. And we call ourselves Pre-Health Shadowing. All of our social media is also Pre-Health Shadowing. Go ahead and get someone. So just so you know, we do have closed captioning to accommodate students for their abilities and their needs. This is not perfect. So if you have any issues with your closed captioning, or for whatever reason something's not working, this is recorded. We will have it up as soon as possible. We try to have it up within 24 to 48 hours. And then you can also get the transcript from that. It will also be uploaded to YouTube and you can get the transcript there. But if you do need some additional notes, feel free to email us at info@prehealthshadowing.com and we're happy to provide you with some notes or answer any questions that you might have regarding this session. You can also email us and let us know if you have any ideas about how we can be more accessible. We're always looking for how we can be better in our closed captioning or in our notes or in our abilities to reach other students. So let us know if you have any ideas about that, and you can join our email list and add us as a contact so we don't go to your spam. It's always the worst. So if you want to stay in the loop, we do have various social medias. We have Instagram, TikTok, Twitter. We do have a Facebook, and we do have LinkedIn and YouTube. So those are all ways that you can stay on our sessions or stay up to date with anything that's going on in pre-health shadowing. We always say that we host students from all over the world. I love seeing international students. We usually get a lot of people from the East Coast. I am on the West Coast. My name is Kira, by the by, and I'm sure a lot of you are probably from all over the world. I do not have my chat open, so I can't see if anyone's from anywhere, but if you wanted to unmute and say where you're from, you're more than welcome to. I'd love to hear some voices in here, especially in the Q&A later.
I'm from Texas.
Ooh, Texas. You're like the middle ground. You're between us, East and West Coasters.
Yeah.
From Toronto, Canada.
Toronto. Love Toronto. My family is from Quebec area as well.
Nice.
Anyone else? Oh, hey, my chat's open. I just see Canada on there. I love Canadians. Not that I am. I mean, I am one also, but we'll keep going. So if you're interested in being a volunteer with us, we have a few volunteers on right now. I'll go ahead and rename them so you guys can see them. And maybe if you want to ask them a question privately, you're more than welcome to. And if you want to also become a volunteer and you can join our community of volunteers, you can learn about a lot of different stories, a lot of different people, see a lot of different viewpoints. You can register on our website to become a volunteer. It's under that little Get Involved tab. Hopefully, I can also send you the link as well. The opportunity is 100% remote, which is amazing. It goes with any schedule you have. Sometimes you're up at 2 in the morning and you want to help out with some things. It's a great way to get volunteer hours. It's 100% supported by the AAMC, so we are registered with them, so they do accept our hours, and then you'll get shadowing hours through these shadowing sessions as well. And I'll speak to the certificate of that a little later. There's also something called our leadership team. You will join on for more hours than volunteering. Volunteering is more flexible. You can do 0 hours in a week, or you could do 10 hours in a week. Our leadership team is about 5 to 10 hours. It depends on the position that you join. It is also 100% remote. Here's a few of the available roles. If you look at the end, now it says other. That just means that if you come up with a role that's not on this list, that maybe you've been doing with something else, or maybe your skills just don't fit into one of these specific roles, you can make your own role. We also have a few different roles that we've been in contact with and creating. The link is below. You can also just go to the Get Involved or the volunteer section of our website. You can learn more about our leadership roles. You do get a title with that, and then that looks very good on your CV or your resume. So if you wanted to do that, I'd highly recommend you go and apply. It is an interview and an application, but it's very fun. I'm the marketing department head, and I absolutely love it. I love working with all the volunteers and the people that are in our little community. If you have any questions about that, you can talk to me about it afterwards, or you can always email us at info@prehealthshadowing.com. Also, if you're a high school student, we sometimes have high school students and sometimes we don't. It's a little wishy-washy. I get a lot of emails from high school students. We have a lot of high school volunteers as well. But if you are a high school student and you're watching this recording or right now, we do have the high school training program, HTP, which is an educational program. We work with you to start a club or an association on your campus. It is trained, so you will have full information on how to do that. It is not by yourself. So if you wanted to do that and you wanted to help people on your campus get a little more education or build that club so that you can put it on your CV or your resume, we're very happy to always get some more high school people who are involved in trying to get more resources out there for pre-health students. So something that we've been trying to push for more so in the marketing department, but is the diversity panels. We used to have a lot of these way back when, and we have had them scattered here and there, but I would love to get more diversity panels going on racial disparities or LGBTQ, IA2 plus, if you're keeping up with the acronym, as sexism, any kind of ageism, ableism, any of those, and have a panel. So if you know someone that's inspiring, that would be willing to talk about any of these topics, regardless of if it's in medicine or not, then you can always nominate them. To do so, you could just email info@prehealthshadowing and say you have a nomination for someone who wants to do a diversity panel, and that would be amazing. Somewhat lastly, if you can donate, we do run solely off donations and the time of our volunteers. So if you can't donate money, you can also donate your time and become a volunteer. It does help our program stay free. We are 100% free. You don't pay for a single thing in our program, but we do have to pay for like the Zoom and the upkeep of our website. So we always say if you can't donate, even if it's $1, it still goes a long way. And if you can't, you can always reach out to family or friends that you know that love supporting nonprofits, and then you can reach out and say, "Hey, do you have a dollar?" Because a dollar goes a long way. But yeah. There's a QR code in on our website. You can also find the donation. So we do have a Q&A at the end. Maybe Isabella wants to go off the rails and she wants to answer questions during the session. She's more than welcome to. Sometimes the questions kind of flow with the conversation and sometimes they don't at all. So we will have 20-minute Q&A roughly about, and then our co-hosts will ask them or I will ask them during the Q&A. And then don't worry about your question getting shuffled in the messages. Just send your question whenever we do keep those on a note. So I will be going through and asking those, or Darian will be going through and asking those at the end of session. So just post your questions away. So take good notes. We do have an assessment after the end to get your certificate. You don't just automatically get that. I'll be going over a short presentation on how to get that certificate at the end of this to earn your digital certificate. So let me know. And if you could put your camera on, I always love seeing faces and I always love hearing voices. So if you want to put your camera on, that's great. If you don't, no worries. You don't need to. And I leave it up to you, Isabella.
Alrighty, thank you so much. Hi everyone, my name is Isabella. I don't know if any of you guys know me from Instagram at all, but I run the Bella in Med page. I'm a third and a half year. My little timeline is a little weird, but I'm a junior at Cairn University studying pre-med biology, kind of on the traditional route. And hang on while I try to put my screen up here. Let's see. I am a little bit of a grandma when it comes to this. All right. Is that working at all?
Yep, you're good.
Okay, perfect. So today I'm just gonna chat with you all about like all of like the secrets to success that comes with being a pre-med student. Because, you know, a lot of people like to gatekeep like all sorts of like this itty bitty little secrets that build up to become something that you can actually use to thrive during your pre-med years. So let's start off with kind of seeing what we're covering today. I'm going to give some tips and pointers of how you can plan out your pre-med journey, how to choose extracurriculars that actually fit you, give some general networking tips and other sorts of pre-med advice. Again, I want to cover a lot of what most people try to gatekeep, because that's kind of something that I feel very strongly about, is not gatekeeping anything when it comes to medicine. Do want to have a little bit of a poll and see where is everybody in their journey. Oh, I probably shouldn't do that. There we go. Yes. So just type in the chat where are you all in your journey? Are you high school, college, post grad? Like, I'd love to know where everybody is. Let's see here. Oh. There we go. Okay. I think I froze up for a second. All right. So 9th grade, undergrad, senior. Okay. All right. So there are some high school students. Perfect. Okay. All right. Well, thanks for all of your input. And I'm just going to move forward here. So kind of planning your journey. It's like you want to make a journey that fits you, right? Like you don't want to try to be like everybody else, because you know, this is your story. You are building who you are, and you are, you know, everything that you do in these next few years is going to be part of your story of why do you want to go into medicine? Why do you want to be a doctor? Because that is the ultimate question at the end of the day. You have to be able to show medical schools, yes, this is why I want to be a doctor, and I understand what it's like to be a doctor, and I feel very passionate about it. And so you have to really kind of be very strategic when it comes to your journey and all the decisions you make. But what I always like to tell people is, you know, you don't just have to do everything that's just medicine, right? You want to show that you do have a little bit of a life outside of healthcare and everything. So, yes, you should be working in jobs that build your clinical experience and gives you lots of patient interaction, but also go after that dream project of whatever it is. It might be a business venture, some sort of other dream project that you have. Like, I always encourage people to go after that and like to actually foster your skills in areas outside of medicine, because not only is it gonna, you know, give you skills that things in healthcare doesn't necessarily give you, but it's also, you know, it's your life. You have so much to live for, and you don't have to stick with everything just in healthcare. Um, like for me personally, I have a big interest in finance. So recently I've been building a website to, you know, do a little bit of education stuff here and there with pre-med things, but there is a big business aspect to it. So like, it's just things like that. Or if you love art and you know, you hold an exhibition or something, that is huge and that is awesome. And med schools love to see that you are a well-rounded individual, and you know, you want to be able to show them who you are through your journey. And yeah, and I would just be really open-minded as well. Don't confine yourself to just, oh, I want to do X, Y, and Z, and that's it. Like, that's how you really limit yourself when it comes to opportunities. One thing that I've experienced personally is that I thought that I was just going to be only a nurse assistant, and I was like, nope, I'm just going to stick with this job until I graduate. But a lot of things changed, and then I ended up becoming a medical assistant. So like, even though it's like, oh, you just went from one clinical job to another, I'm like, it makes a huge world of a difference, because now I work in a completely different environment and setting. So just being like open-minded about like when opportunities come across, I always say to take it. Some people will tell you, no, don't say yes to everything, but I'm kind of the opposite. I say yes to a lot of things if I know I can handle something, right? You don't want to overburden yourself with too many extracurriculars either, because that's how you get burnt out. And you know, you don't want to get burnt out before you even get to med school. So, yeah, that's kind of just tips that I have for in that regard. Let's see. Oh, and this is specifically for my high school students that are on here today. My biggest encouragement to you is to get certified in whatever you want before you get to college. And I cannot stress this enough because when I was doing my certification, I did it during my freshman year, and that was really rough. But I was able to finish it out. But like, I definitely wish that I did it before I even got to college. So that is my number one advice. Like, it can be a CNA certification, a medical assistant certification, phlebotomy, or whatever you want to do that's clinical or anything really. My biggest advice is to do it before school starts, so that way you can have time to focus on everything you need to focus for college, because your grades are still very important. You want to do things that can help you maintain those grades. But and my second thing I'll tell you guys is that to email your professors before you even meet them. And I personally did this, and I think it set myself up for very good connections with the professors I have. While I do go to a smaller college, those connections kind of make it easier to have. But being able to reach out to your professor before you even get to college not only shows them that you have initiative, but like that you want to actually get to know them and to form a true connection, and not just, oh, I want to get your letter of recommendation or something. Like, you don't want to come off like that way. You just kind of want to be like, hey, this is who I am. I'd love to get to know you, and I'm excited to have you as a professor, and X, Y, and Z. So that's what I recommend for all my incoming freshmen that are going to college, either this year or next year, wherever you are on your journey. And this last point kind of ties into that first bit of here of getting certified, is to find a clinical job during your freshman year. And why I say that is that the sooner you can actually start working, the sooner you can get your clinical experience and start building up those hours. Like, I started working as a nursing assistant in a long-term care facility when I was in, what was it, freshman summer, like the summer between freshman year and sophomore year. That's when I started to work. And it did really good for me because I was able to stack now all of my different clinical experiences. I didn't have to wait until the last second to be like, oh, I'm about to apply next year. I need to start working. Like, you want to start working way in advance. So that kind of gives you the flexibility of, do you want to stay in that position or do you want to transition to something else? And it also gives you a really good insight in healthcare in general, before you know, go too deep into your career there. Because yeah, being ahead of the game is going to make everything so much easier, and it gives you that flexibility of what decisions you want to make, what direction you want to go in, and etc. um Another little bit of a poll time, but I'm just curious to see what areas of healthcare, medicine, or whatever are all of you interested in. See it, immunology. Immunology is really cool. Oncology, psych. Okay, we got a good mix of people. Love that. Psych, cardio. Okay. Ooh, oh, I see obstetrics. To be honest, baby birth always freaked me out. So whoever was that, you're really cool for that. Really cool for that. Anesthesiology. Okay. Awesome, awesome. Um, yeah, thanks for you guys' input. I always just like seeing what people are interested in so that I can kind of give you tips and pointers for you. But this next part is about actually finding extracurriculars that fit you, right? Back to the point of, you're building your story, you're building who you are and what your mission is in life, right? Because I'm sure each and every one of you have a reason of why you want to be in healthcare, in any sector of healthcare. And like, right now is like a great time for you to actually reflect on that. Why do you want to do this? Because I will tell you right now, if you're doing this for the money, it is not worth it. You don't get the money back that you invest in this kind of career. You really have to be passionate about serving others, and actually taking care of people. And so with that, passion, you want to look even deeper. What specifically do you really feel a calling for? Do you feel a calling to serve? Do community health, you could do rural health, you can do global health as well, where you travel to different countries. Or are you interested in research? Because there's a whole world of research that can be done. And I'm pretty sure in almost every single field of medicine and healthcare, there's a research area to that. So, because again, medicine is growing and it's ever so evolving. The more we learn through research, the better we can take care of our patients, right? And this might be a little bit more advanced thinking, but are you interested in working inpatient inside hospitals or outpatients in like clinics or things of that nature? Or you can look into specific areas of medicine. Are you interested in emergencies and helping someone, like saving their life? Or are you interested in continuity of care, being able to, like be with patients long term and get to really connect with them and help them in their health throughout their life? Or is there any specific populations of people you really like to work with? Maybe you like to work with kids. Maybe you like to work with adults or the elderly. Those are all really important things to think about now so that you're able to choose those extracurriculars that actually fit your interests. And I know when I was in high school, I never really thought about any of this specifically until about my sophomore year is where I really started to think about, like, what am I even interested in? What do I want to do? Where do I see myself? And so these are just a few things that I have here on the right that you could do. You could do hospice volunteering if you really like working with elderly populations, or simply like being a companion to people in their final moments of life. You could be a CNA. I'm always a big advocate for being a CNA. You could be an EMT, where they ride around in ambulances and help with life-saving procedures and everything. You could be certified or non-certified medical assistant. I will tell you that it's a little challenging to find positions as a non-certified medical assistant, but it is possible because I've done it and I'm currently doing it. You could be a phlebotomist. There's so many different things you could do. I know a few of my colleagues, they've done rehab aides, where you help physical therapists provide care for their patients, which that's a whole other world of things too. Some people who are doing kind of a non-traditional pathway, they choose to become a surgical tech, where you help surgeons in the operating room. Or you can be a unit clerk, where you help organize the workflow of a hospital unit. Really anything that in that regard that gives you some patient contact and helps you understand healthcare as a whole. There's also the different areas of research you can do, either clinical research, where you're doing something related to a field of medicine, or basic science research, where a lot of it is more cellular focused. There's like translational research as well, which that's one is a little bit more complex. I personally don't really understand it, but I know it exists. So I'm like, I might as well mention it. Um, you could do volunteering in community clinics, or in urban areas where they do like the wound care vans for people who are injured out on the streets and they can't afford care. You can also join and do something like that if you feel really passionate about urban community health. You could do inpatient volunteering in hospitals, and there's so many different opportunities depending on what hospital you have that's around you. Um, but you can like probably volunteer in the surgery waiting rooms or the ER, helping out with organizing everything. You could even be a patient companion. I know some hospitals do that, where you really just keep them company and help them feel a little less alone. It's similar to hospice volunteering, but it's just like in a different environment. But you could also do that. Other great ways to build your extracurricular list is to do leadership positions in college clubs or organizations. I'll throw some examples that I've done. I'm currently the president of the Health Sciences Club here at Cairn University, and I've also served as the treasurer of a Student Cultural Association Club. But you can honestly get involved in anything you want. Again, just always keep in mind that you are building your story, you are building who you are as a person, and yeah, you're just doing things to help market yourself to medical schools, because that's really the truth, is that you're marketing yourself to medical schools. And I also tell people, pursue all of your hobbies. Like if you are passionate about sports, go play your sport. Go, if it's like intramurals, or like if the actual team of your colleges, or anything of that sort, keep doing it. And because it's also, I think, is a really good for stress relief, and it just helps you find enjoyment in the midst of all the chaotic studying. But yeah, and again, like I've said previously, don't confine yourself to only medical related extracurriculars. I have like the biggest regrets from that area, because again, it wasn't until like sophomore year until like I actually started expanding to other non-clinical areas in life. Because to a medical school, you don't want to seem like a checkbox pre-med student who are like, you got your research, you got your clinical experience, you got some leadership, and that's about it. Like, you don't want to let yourself fall into that trap. And they want to see that you have passions outside of medicine and have actually proof of those passions outside of medicine. And yeah, you just want to be able to, it's both going to be a big help to you as you continue your studies, and honestly throughout life, to build a life outside of healthcare. This is a true secret to anything related to connections, because as a first generation student, I don't know anybody. Nobody in my family has gone to medical school. None of them are doctors. The closest thing that I have is my mom's also a CNA. So that is the closest thing that I have in my life. And I'm sure many of you can relate to this, because it is hard to make connections in healthcare and in medicine when you don't know anybody. But that's why I always give these pointers to building and fine-tuning your networking skills. Oh, is that gonna, oh, I went a little too fast. Hang on there. All right, there we go. But yeah, so you're gonna meet people from all sorts of backgrounds, and everyone's gonna be in different careers and everything. And having a strong network of individuals who support you along your journey is a absolute game changer, because those are going to be the people who not only support you in your journey to med school, but also in life. Whenever you have a problem in something in life, you all have people to back you up, people who can provide resources to you, and that is very, very important for success in any career, is to have a strong network of individuals who are there for you. And some of these people, maybe not everybody, but they'll probably be willing to write you letters of recommendation for anything, for med school or for jobs or anything. And some of those people who you build networks with may actually offer you jobs and offer you internships and everything. And I know this is true, because for me, I did not know anybody in research, and I was very fortunate to find out that one of my professors, whose friend goes to University of Pennsylvania, he's a PhD PI there, and he's like, "Oh, I get you guys connected," and that sort of relationship and maintaining those relationships is very, very important, because you never know who's going to be able to help you at any given time. So my advice to everybody is, like, don't burn bridges. Even if you don't have a really good or strong connection with somebody, don't burn that bridge, because again, you never know, one day they might turn around and come to help you, even after a world of hurt. But how exactly do you do this? And really, there's four big points that I want to make. Is one, learn to actually write good emails that get to the point. When you're writing an email to any professional, you don't want to be rattling off about like who you are and everything, or what your interests are. You don't want to be way too long, but you also don't want to be too short either and not give enough information for them to, message you back. So you want to have a healthy balance with when you're writing your emails of an introduction, like I'd say like between 2 or 3 sentences of an introduction, 3 sentences for why you're emailing them, and then a little thank you at the end, and leave it at that. Um, and when it comes to your elevator pitch, not a lot of people understand what this even means. It's basically like when you go to meet somebody, whether it's in a professional or non-professional setting, it can be something that is it's just like 1 or 2 minutes you explaining who you are and what do you do. If you've done research before and you're talking to somebody in research, you briefly explain your research and have your contact information ready to go. But you could also do this when you're going to offices to seeking shadowing opportunities in person. You could always just be like, my name is so and so. I'm a student at blah blah blah, and I have an interest in blank. Is there any shadowing opportunities at this office? That's kind of like my bit of a template that I've kind of come up with whenever I go, because that's how I had to do it. I had to go door to door to actually get any shadowing opportunities, and now I'm really happy to say that I've been able to shadow in 7 different specialties, which goes to show that this kind of method, it works, and it works really well. But this next piece of advice is kind of more of a general piece of advice outside of networking, but get comfortable being uncomfortable. Because if you're an introvert like me, it's going to be really awkward whenever you're starting to do all of this networking. You're going to fumble on your words and not really know what to say and how to say it. So you learn from those mistakes, and you learn from each time you say something that's like, oh, that's a little awkward. Maybe I shouldn't say that. But it's a learning process, and over time you're going to get more and more comfortable talking to people, talking to strangers, and you want to build those skills. Each conversation you have with another professional, you want to use that as an opportunity to enhance your skills and enhance your ability to speak. But I would also tell you that you want to reach out to people even outside of medicine. And I say this because, again, proving that you have a life outside of medicine, you might, if you're interested in business, if you're interested in communications, if you're interested in marketing, you want to be able to like maybe get an internship and learn more in that internship about whatever else you're interested in. And being able to talk to people outside of medicine is also going to be really important, because the way you talk to a doctor might be really different than how you talk to the head of social media from somewhere. So be adaptable, be flexible with people, and just kind of be able to read the room really well. And that is kind of, you want to be creative in how you introduce yourself and everything else as well. But yeah, that's all I have for you guys. I will take any and all questions.
Well, Mel asked earlier, do your experiences need to be hands-on? I'm a medical biller and I want to know if that's a good as a hands-on job.
I wouldn't say medical billers hands-on, and I think it is really important to have hands-on experience, but medical billing does give a lot of insights in how healthcare functions, and that's definitely something you can include in if you're looking to go to medical school. That's something that you can include in those applications, but I do strongly recommend that you get like some form of hands-on experience. Some of the jobs that I've mentioned before, like a CNA, medical assistant, EMT, phlebotomy, like those are all like really hands-on, and you get to talk to patients, and you really get to learn those clinical skills too of how to take blood pressure, how to do vitals, how to do take blood, and those are all like will also help you during your first year of med school when you're learning all those skills and be like, oh, I actually know how to do this. So, that's always something good to have. And medical schools want to see that. They want to see that you have experience talking to patients and providing care, and you understand what it really means to provide care. But great question. Thank you.
Thank you.
Nahom asked, do you have any tips for non-traditional students?
Um, what kind of non-traditional student are you? Yeah, just feel free to say it. Yeah.
Yeah, I just graduated from math and I'm like currently working now.
Mhm.
So my undergrad was in math and I'm like considering applying to medical school. So like just I know it's not necessarily your current pathway, but like do you have any just general tips for non-traditional students?
Great question. Thank you so much for asking that. Um, I think some great things that as a non-traditional you could do is, probably like working in like a full-time setting where you do get a bit more of experience in that area. Depending on where you live, some offices might be willing to hire you as a medical assistant and train you. Um, with your math background, I would also really look at becoming a clinical research assistant because in those settings, yes, there's a lot of like computational and being in a lab, but those are excellent like type of positions to get if it's affiliated with a hospital because the doctor who you work for or the PI or whoever will know other people and then you could shadow and potentially do other work with other people, and that's kind of how you do all of the networking things. um but yeah, I would definitely recommend like working in an area where you can get the sort of connections because again, it's not easy to get those sorts of opportunities and everything, but through employment it becomes a lot easier.
Thank you so much.
Hmm.
You're also considered a career changer. I'm also a career changer. If anyone ever asks
There you
what
go.
type of non-traditional you are, you're a career changer.
Thank you for the tip. Yeah, appreciate that.
No worries. Lewis, hopefully I'm saying your name right. Said, so I'm going into 10th grade and I still haven't decided on my career. Understandable. Like I want to go into econ, stats, or engineering, which I think are more interesting, but I have a doctor as a possible career option. Is there a reason or something outstanding about being a pre-med major or having a job in medicine?
Hmm. I think it just comes down to what do you really want to do with life? Like, where do you see yourself, and what do you feel passionate about? Like, do you like I see you like econ, stats, and more of the mathematical areas. Like, do you feel more drawn or interested to that in comparison to learning about the human body, or I would just kind of think about like, could you see yourself dealing with like patients as a job? And that's how I, kind of pictured it for myself. Like, would you want to be in a hospital for 40 hours a week, seeing patients, doing surgeries, or really want to try to picture that life? Or do you see yourself more in the other aspect with all the mathematical focused areas? But I think it just really comes down to what do you really want to do. And I know something that's really common for students to face is that they get pressure from families to be like, oh, you got to become a doctor or lawyer or something. um Honestly, I would just block them all out because at the end of the day, it's your life. You want to build the life you want, and the people who may or may not be telling you to pursue something over something else, um they're not going to be the ones to do it, you know what I mean? And I my next question for you would be like, what is making you consider medicine? Because it is very different from engineering. So like, I'm really curious to see what is leading you to becoming pre-med.
Like, um, I just think, I just think I'm good at like memorizing stuff and also like pretty decent at like, you know, like hand skills and stuff. So like, I think I could be like a surgeon, but I just also have like a lot of like, options. Just haven't decided yet.
Yeah, yeah, no, that's totally understandable. There's the nice thing about medicine is that you can combine like engineering and medicine to do bioengineering and do something in that aspect. And it seems, correct me if I'm wrong, but you're more interested in kind of the logical side of medicine instead of the clinical side.
I mean, like, I mean, I like engineering. I like um more like physically skilled
Mhm.
jobs.
More of like the hands-on kind of work.
Yeah.
Then yeah, I would just keep exploring. You have plenty of time to, decide. And honestly, you don't even have to go to college right away. You could work and see what you like, do some internships, or even just talking to people in the profession gives a lot of insights. Um, I will say though, if you want to do stats, econ, or engineering, it is a lot shorter of education than medicine, and that's something I always like to warn people about. I'm like, you will be in school for at least 8 years minimum, then plus residency, you will be doing more schooling. So that's kind of like the bit of a reality thing that I always love to mention to my younger audience is that it is a long road, and you really have to have the heart for it. So I would just keep exploring, see what do you really, what do you feel passionate about, and document those things. Keep like a little journal and always like reflect back. If you, I don't know if you're doing like volunteering or something right now, but I would just keep track of everything that you're doing, all the interactions and experiences that you have, and just reflect on it often, especially leading up to graduation. But yeah, if you got any more questions, just throw it in the chat. I'd love to answer it.
Um,
Thank you.
Hmm.
I had a question. What certifications would you recommend for like to get if I'm in high school? Like what kind of certifications?
First question I have is how old are you?
So I'm in ninth grade.
Um, yeah, so there, I think you would have to wait a little bit to do a certification, but I know you can do, I think you can do most like healthcare related certifications when you turn 16 in most states. I don't know about Texas. Um,
Yeah, I think it's 16.
yeah, but like the ones I mentioned before, like the CNA, the certified nurse assistant, um, medical assistant, um, what else did I say? Phlebotomy. All of those ones are really great because they give you like that hands-on. EMT is also really great. I know a lot of people who do that and they love it. For me, I just didn't choose EMT because I was like, I don't want to wake up at 2 o'clock in the morning to go, save someone from, something. Like I like more of like the structured schedules that being a medical assistant and being a nurse assistant gives me. And if you also want a job that gives more flexibility, oh, my leg is bleeding. That's fun. But what was I saying? But yeah, if you want jobs that give you more flexibility, my number one recommendation is EMT or nursing assistant. Because at least when I work as a nursing assistant, I have an agency I work for, so I can pick up shifts whenever I want and go wherever I want. Like I don't have to be tied to like one place or another. That's just my personal preference, just because that's what I've done. I haven't been an EMT. I just know things from my friends that are currently EMTs. But being a medical assistant, it kind of most of the medical assistant positions are outpatient, so you do get that like experience in healthcare. But the nice thing about being a CNA is that you can work in any setting. You can work outpatient, inpatient. Um, I even know that some companies hire remote to do like documentation and everything, which that doesn't really give you clinical experience, but it's another job that you can have. And when it comes to pay, at least in Pennsylvania, I don't know about other states, but nursing assistant pays the most. But it is also one of the harder jobs too. But yeah, if you have any questions about like what does each role do, I can also answer that or whatever else you want.
So we have another question from Dion. Hopefully I said your name right. I'm sorry. How can I gradually work up?
The Dion.
Oh, it's Dion. Okay, thank you. How
Yeah.
can I gradually work up from having social anxiety so I can ask professionals for shadowing? Also, how can I incorporate all of these into a strict schedule? I'm planning to go on an accelerated path where I graduate in 6 years from pre-med and med. The schedule is kind of tight.
Wow, that's first off, congratulations for that kind of um path because I know those are hard to get into. Um for the social anxiety thing, from someone who I have a diagnosis for for anxiety, one of the biggest things that I do before I step into any clinic, because again, how I got my clinical experience or shadowing experience, I just went door to door to a bunch of places and came with my resume. But you kind of really just want to whatever works for you to like reduce anxiety. Like for me, I like to breathe. Like I do like the 4-4-4-4 breathing pattern where you hold in for 4 minutes or 4 seconds, breathe out for 4 seconds, and you kind of just like repeat that kind of cycle. Um, and that's what works for me to help me like in the moment to okay, I'm at the door, I'm trying to like go in and say something, and yeah, you just kind of say it. But I also, for some people, you like to like some people like to pre-plan what they say. Like when I started off, I kind of wrote like a mini script. I'm like, I'm gonna say my name, I'm gonna say my school, and I just kind of went down a list of like every single thing I was gonna say. And so in my mind, I'm like, yes, this is what I'm gonna say, so I don't sound like I'm crazy because that was always my biggest insecurity. I'm like, what if they think I'm just nuts for just walking in the middle of the day. So I think it's just really it's more of like an exposure thing. Like the more you do it, the more comfortable you're gonna get with it. And taking that like first leap is gonna be a little awkward. Like you might be like, oh, I might. And I know for me, I forgot my own name the first time I went. So yeah. So like it's really just like you just gotta get used to fumbling here and there. But I think over time it's really easy to just go in and be like, hi. For me, it's like, hi, my name is Isabella. I'm a student at Cairn University. I'm interested in becoming a physician. Do you guys have any shadowing opportunities with providers here at this clinic? And that's it. And then, depending, they say yes or no. If they say yes, I just hand them my resume and leave. Just keep it nice, short, and sweet. You don't want to be in there for more than 5 minutes unless they're chatting with you or whatever. But I think keeping it short, like those short introductions, makes it really easy to not get like overwhelmed by the anxiety that comes with it. But and when it comes to your scheduling, I would say that the biggest thing is to like no like block out all of your time that like you want to be studying and have like small slivers of time where you can go shadow. Like I know for me when I was shadowing during the semester, I blocked out like um 1 4-hour like block per week to go shadow for whatever I'm doing. Or I know some of my other colleagues, they kind of had like a day where they didn't plan too much and they had like more flexibility. And then all the other days they would just like study like crazy and they just had like one day to just breathe and relax or to go shadow. That also helps as well with being able to share your availability with the provider and be like, oh, I'm free on like Wednesdays at whatever, and just kind of keep it. You want to keep it really simple for yourself, and it's also good to block out that time to just kind of relax because having like one rest day from school is nice, and you really want to again don't burn yourself out with everything. If you feel like you can't do too much, I would try to do it during the summers where you're not really doing a lot of studying. But if it's like a year-round thing, I don't really know what to tell you, but something like that. But if you have any other questions, I could just say it, or if that was helpful, just let me know.
Thank you, thank you.
Mhm.
So leading into the anxiety thing, interview question. Do you have any
There you go.
tips for passing interviews? Because in the college I'm trying to apply for, there is this interview portion for them to determine if we're admitted or not. And I don't know, I don't have any experience in interviews, and I'm kind of anxious about it. Do you have any tips on how to pass an interview or any experiences?
Um, well, I don't know how you say your name, but thank you for the question. Um, when it comes to interviews, like I know I kind of deviate from like the norm. I don't prepare for my interviews. I just kind of go in and I just wing it. And I think for me that's what's worked because if I prepare too much in advance for an interview, then I feel like I sound weird. Like when it comes to like talking about yourself and shadowing, that's like one thing, but like sitting down with a person and having like you don't know what the interview is going to ask you. Like they can ask you what color is the moon. Like like I don't know. I, I don't know. But yeah, it's like for me, it's like I don't want to prepare that much in advance. Like I'll have like a general idea of like if it's a school, right? You want to have ideas of like what are their main values, what kind of applicants that they look for, like especially if you're doing for med school, right? You want to look research about them and be like, oh, they value people who like working in underserved communities or something like along the lines of that. And then from there it's like you just have that in the back of your mind, but like you don't want to sound rehearsed either because they'll know that like we essentially schools want to see that you're a real person. Bottom line, they want to see that you're real and you're authentic and you are who you said you are in all of your essays. And I would just like always read back on what you wrote just to like jog your memory, but I wouldn't be too worried about that. Just be normal. My number one tip: be normal. Don't be weird. Really, like all the med students who I've talked to who did their interviews and whatever, they're like, just don't be a weirdo. Like, just don't say something that's like really out of the norm, and you'll be fine. But if there's something specifically about the interviews that you're worried about, just shout it out. Or if that was helpful, let me know.
I liked it. I liked it.
There you go.
Montserrat. I'm gonna butcher names. Just accept it. I butcher my own name sometimes. That I understand that you don't need to choose a path immediately, but I'm debating between whether to pursue research or becoming a doctor, and what are the pros and cons to both. I also have an interest in international law and global public health that influences my decision, but I also, planning really long term, want to join the MSF.
I guess my first question is, what is MSF?
It's the medicine sans frontières. It's the Doctors Without Borders organization.
Oh, yeah, yeah, I heard of them. That's pretty cool. But um, let's see, pros and cons of becoming a doctor and whether to pursue research. I would say, hmm. Well, if you want to do both, I guess the downside of that is you do have to do an MD PhD program, which that does take longer because you're doing both medical school and you're doing a PhD, which I think what is it like 9 or 10 years or something like that. And you still have to do residency afterwards. So I guess that's the downside in my perspective, just because that was what the biggest turnoff for me was to doing like a MD PhD program. Because I kind of like the research that I did. I just don't want to go to school for that long. So I'm like, you know, it's okay. Because as a doctor, you can also still do research. Like you don't have to have like a PhD or anything, or you could just graduate med school and do residency and you can go work in research. And there's plenty of doctors who have done that, um, at least that I know and talked to. Um, so that is a pro about, that kind of areas. Like you can be an MD or DO and do research without a PhD. So, you know, I would say that like explore those avenues, see what you again, like see what you're really interested in and take time to reflect of like what about research or what about international law, what about global health is piquing my interest. And because I think the biggest thing right now you should be focused on is deciding between the law or medicine because those are two different worlds of careers. So think about that first and then like, that will kind of at least point you in a direction of where you're going in life because you don't want to apply to med school, go to med school and realize, no, I want to go to law school. And like, cause you're already in med school, you know what I mean? Um, but yeah, so I would think about that and everything else, like specifics of like medicine. that comes with time and comes with the things that you do in life. And I wouldn't be like too, worried about like what specifically do you want to do, but like just like a general career of like, yeah, I want to go this way or this way, if that makes any sense.
Thank you.
Yep.
There's one last one from Mel. What can I do to stand out when applying to medical school? What is the most important factor in a successful application?
The number one thing that every single med student I've talked to, which I probably talked to almost 100 right now, and that's not even an exaggeration, is your personal statement and your activities description. Because you could have a 4.0 GPA, a 520 MCAT, and someone will still reject you. And that is the reality for a lot of people, is because they don't know how to market themselves. And learning how to market yourselves is a challenge in itself. Like, it's something that I'm still even working through, but from what I've learned is that you really want to be able to speak about you, not whatever you did, and not exactly, who did it with you. Like, medical schools don't care about that. They care about what did you do, what did you learn from what you did, and why is it relevant to your story, is really the three big pointers for that. The med students who I've spoken to, they said, your personal statement tells the why. Why are you going to medicine? Why do you want to be a doctor? Why do you even want to go into this field? Your activities will describe what did you do, what did you learn from what you did, and how are you going to apply those principles as a future physician. And those are the points that you want to focus on when you're doing that. But it's really the biggest thing that I would say is that writing part of it, because again, like, I know somebody, she had a 3.9, and I think she had like a 519 or whatever, and she got rejected from every single school she applied for. I think she applied for like 30 plus schools. And it was really just because she did not know how to write about herself. And that is just as important, if not more important, than your actual scores. One of the med students who I talked to went to U Chicago, which their med school is also very hard to get into. And he was like, I got a 509 and I had a 3.5 GPA. And it was because of my stories and experiences that I got in. So, like, you really just have to learn how to market yourself. I would also consult people, like, try to find med students and other people to talk to, like, to get more details of, like, how to actually do that. Because it is hard. It is very, very hard to do that on your own. And I think it goes back to the networking thing. Having a strong network will help you, and people in your network will also be there to read over your stuff, tell you from an outside perspective, hey, you should or shouldn't say this, fix this, X, Y, and Z. And you really want to find people who will tell you the honest truth of like, this is good or this is garbage. Because I've had someone tell me straight up, this is garbage, start over again. And I was like, all right, thanks for your input. But it was good because I have somewhat of a strong, I'm still working on mine, but somewhat of a strong application. So yeah.
Thank you so much.
Yep, no problem.
I've also been in the garbage route of things. Like, you can't make a great personal statement until someone tells you your story is garbage.
Yep.
A little bit of questions on kind of your background. I know that you're getting your BS in biology. Can you speak to kind of the program you're in and how you chose that program?
If I'm gonna be completely honest, I came into this space because when I graduated, this kind of gives a little bit into my story. It was the day of my graduation in high school, and I was ready to come to this school to do criminal justice. I had no intentions of doing anything related to healthcare, but 3 o'clock in the morning of that day is when I found out that my grandma died. And not only it wasn't just the fact that she died, but it was the fact that she died from something so simple, something that was very, very treatable. She had a ruptured appendicitis, and in America, it's very easy to treat that. In Brazil, where she was at, in the middle of nowhere, she died just in her house, and the neighbors found her. And when that kind of reality hit me, I was like, well, this is not okay. People shouldn't have to suffer and die simply because there's no access to healthcare. And that's kind of where the shift started to become more interested in healthcare versus criminal justice. And so because I was already committed to the school that I'm in now, I was like, well, what am I going to do? I don't want to do criminal justice anymore. And ironically, they had a biology program here. So that's kind of, I was like, oh, I'm just going to switch my major. And, because the school I go to is really small. They're more faith-based. So like, there's not too much about science stuff. But with the ones that we have, it's really just biology. So I was like, whatever, it's fine. Because I also didn't want to transfer and fill out the transfer paperwork. So that is just the pure honest truth. There's no calculations or anything. But if I were to be able to start over again, I would love to have majored in business and just take the pre-med classes on the side, because I think business and finance are very interesting. And I think they go hand in hand, especially with today's worldview on healthcare. Unfortunately, there's a lot of finance relations. And, being a doctor with that kind of background, it makes it a lot easier to advocate for patient care. But that's just me. And just a pure honest truth. I just transferred my major. Oh, you're muted.
Oh, I said I'm
There
also
you
a non-trad student, so I understand the switch up.
Yeah.
And just so you know, it is only an extra year, maybe 2 years to get a MD MBA. If you ever
Yeah, which that's what I'm planning on doing. So I was like, yeah, I want to get my business degree, because after I found out that like, oh, these programs exist, I'm like, I'm gonna do that. I'm gonna do that right there.
and then I know there's a few people in here that said onc. I saw cardiology on there as well. Can you talk about your cancer research at all? What you're kind of focused on, what you're excited about?
Sorry, you froze up for me. Can you say that again?
Yeah, what are you excited about for your cancer research specifically? Or what are you working on?
Well, technically, I was in like a research program. Like, I just completed a program at the Pritzker School of Medicine in U Chicago, and there I got assigned to like a hematology oncology PI. But I ended up like kind of liking what I did, and essentially, in a nutshell, I don't know how many people here are familiar with next generation sequencing and other germline testings, but basically we had a giant patient cohort who all of them had this next generation sequencing because they were all blood cancer patients, and we were looking to see if any of those types of cancers were genetic or not. And so we do the initial testing of the NGS sequencing, and then from there we have to look if they're pathogenic, which just simply means, is it likely to cause disease or is it likely to not cause disease? And the ones that were pathogenic, we kind of looked further into their clinical histories to see, oh, oh, hello? Can you guys hear me?
Yeah,
No,
we
I
can
hear
hear
you.
you.
Okay,
Yeah,
cool.
we can hear you.
Cool. Where was I? So yeah, we looked into whether or not they were actually germline or not, which means did they have like a hereditary component or not? And the biggest reason why we even did this in the first place is because this research was already done, but it was like old research. So like we wanted to do like an update research project in response to the previous studies, which only showed 14% that there's like a genetic linkage, but we found 35% of a genetic linkage. So like that just raises more awareness of like, oh yeah, we need to be doing this germline sequencing in follow-up, like as a part of standard care for everybody, not just the patients at University of Chicago. So it was mostly like a big advocacy thing of like promoting the care of plan that they haven't implemented and, was able to do early interventions and treatment for these patients, because that's what really matters when it comes to hereditary patient care, is that you're able to intervene and to actually treat those cancers earlier and help those patients have easier recovery from their cancers, if at all possible, or to make it more manageable. Because if you catch it in earlier stages, even if it's genetic,
I don't know what's up with Zoom right now.
I don't know what's happening.
I don't either. Keeps like disconnecting, reconnecting. Are you good now? Oh. Oh, you're back.
Oh, there you
Yeah. Weird. I don't know. Zoom's been odd lately.
go.
Wait, and then another question. I always get this question. I think at every single session is the difference between MD and DO. And so now I just like asking it to everyone. Do you know the difference between MD and DO? And do you want to explain it and like kind of where you're headed with MD DO, if you care, if you don't care? Thoughts?
Yeah, of course. So I know the biggest difference is like DOs are more, they're more holistic focus, and MDs are more like treatment focus of like treating just the disease. DOs kind of have a different mindset of like they want to treat the whole person and not just their disease, which I mean to a certain degree, right? A lot of that philosophy is now being taught at the allopathic medicine areas and like MD areas, but like there is like a more of a heavier focus on that in DO school. I mean, for me, because I do want to go into more of a competitive specialty, I am looking more into MD schools, but I'm also applying to DO schools as like my safety schools. Just because a lot of the DO schools, they tend to have lower stat requirements or like averages. Like I know there's one school, it's like St. George's in Granada or something, and they accept like I don't know, like 600 something students a year, and their average MCAT is like a 470 something, and I'm like, yeah, but they're also big on primary care, which that's another thing, another pattern with DOs. A lot of the DOs tend to go more primary care because they do appreciate more of that like holistic standpoint. But because I want to specialize in orthopedic medicine, I am looking more into like schools that have that resource, because that's like the biggest thing for me is like, does the school have the resources to help me match into orthopedic surgery? Because that's what I want to do. And every single year it becomes harder and harder. So we're just gonna kind of take it day by day with that. But I am applying to both, for the record. But yeah.
Definitely a good idea. I always tell people if you can spend the money, spend the money. As
Yep.
many apps as you can get.
Yep.
Burnout. You seem highly scheduled, highly on it. How do you kind of avoid burnout, or how do you watch for it? What are your tells? What do you do?
Yeah. Well, I'm not gonna lie, I've probably been burnt out a few times during during my college career.
Which is life.
But yeah, I mean, I think the biggest thing I've learned from like my experiences in burnout is like to not do a million and one things, but then I still end up doing a million and one things. So it's like a toxic relationship I have with my schedule. I always like to keep it full, but then I get mad when I don't have time to breathe. So my advice, schedule time for yourself. Like really, like schedule like even like an hour or something a day that you just have for you. Don't be like me in that aspect, because it's yeah again it's like a toxic relationship I have with myself. It's like I want time to chill, but I know I have to be productive and do all these things, but then that conflicts. So don't do that.
Now you mentioned the save 4 hours, and I was like, oh, this is a calendar lady.
Yeah,
Me too.
yeah.
I'm like, oh, here's my 4 hour.
Yeah, that's something I'm doing new this semester. Like my Friday evenings, that's just me time, and I'm not gonna do anything. No
Good.
studying, no nothing, just because, like, again, like last semester, I got severely burnt out from last semester, especially from organic chemistry too. That took the wind out of me because I was also doing anatomy, physiology, and what else was I doing? I know I was taking another course, science course, genetics. Genetics is the other one. So I was taking 3 science courses, which again, don't do that. Don't take 3 science courses at the same time. I don't recommend it unless like you're non-traditional or whatever and you're doing your own thing. If you're taking 5 classes and 3 of those are science courses, delete one of them. I'll tell you that now.
I shot myself in the foot. I took a whole year of OChem in 10 weeks of summer.
Yeah, I would have died. I would have just passed away.
Clubs wise, I know a lot of people are super into clubs. Or trying to get into clubs and they think that they can manage club life. And I know that you also mentioned that you were a part of a club. Did you
Yeah.
find it easy, hard to navigate those two? Was it kind of, I guess, like a break from schoolwork type stuff? Or do you recommend joining clubs? Or what's your
I definitely do recommend joining clubs, and if you're able to get into leadership positions in clubs, that's even better because like then you'll be like really involved and like you still have I think you still have a lot of like with my club, like I'm the president, so like I kind of make a lot of the executive decisions of how we run everything. But because I like to make it fun for my team. And I'm just like, hey, we're all just here to chill, have fun, but we're also being productive at the same time. So that's like our big thing since we are the health and sciences club. Like, we have to do something productive and it can't just have parties all the time. But I think clubs, like if you want to be as a participant in a club, I think it's a great way to like, you know, get involved, get to know the people in your community, and honestly, it builds connections. Again, back to the networking thing, because I kid you not, there was this one girl in a club event that I just randomly showed up to because I was bored one day, and her mom was an orthopedic surgeon, and that's how one of the shadowing opportunities I got was through this girl's mom. Um, and would I have gotten that another way? No, but like just because I went to go say hi to this girl, she was standing alone, and she was like, we were just chatting, and she's like, "Oh, my mom's a surgeon." I'm like, "Oh, what kind?" "Orthopedic," and I was like, so as I'm telling you, like you don't have to go to every event just with the idea of networking, but like you never know what's gonna happen. So I would say like don't go to every single thing that happens on campus. Just pick a few. If you need a break from studying, go somewhere, do something fun, and just have outlets. Like have like ways to take breaks because taking breaks in your studying is very very healthy. I do not recommend trying to lock in for 8 hours straight. Take it from someone who tried to do that for the finals and then I almost failed my finals. So take breaks. And again, don't be like me.
I'm also horrible with breaks. Mel was just asking, thanks, speaking
Mm,
of studying, if you have any study tips.
let's see. Study tips. Um, for me, like when it comes to like actually like sitting down to study, like I like the Pomodoro, like whatever it's called, where you like study for 25 minutes and then you take like a 5 minute break. I really come to like that, and that's what I'm doing now as I'm trying to scramble through all of the I was saying this earlier, but I accidentally signed up for a summer course and I was too late to withdraw from it, but I have like 21 assignments I have to do in a week. So that's I've been using that method to try to finish as much as I can without failing the class. So yeah, I would just like honestly see what works for you because everyone's different. People will tell you, "Oh, use this technique, use this technique." Ignore it all, try it all, and see what works for you. Like, um, I know someone was it was like something on Instagram where they were like, "Oh, you should try this revenge study technique." I'm like, "What even is that?" And it's apparently when you imagine like you're just in a when you get revenge on somebody and it helps you lock in. And I'm like, I think it's just a matter of what works for you. Again, some people are weird and like to do like weird things to manipulate themselves into locking in, but you just really got to see what works for you because everyone's different. Everyone's got their own little quirks. Um, again, mine is that like I need to be timed. Be like, no, I start here and I end here, and I take my break here. Like that's me. So you got to see what works.
I like study groups. I always tell people I'm a parasite and just study
Yes,
on
yeah, I'm the opposite.
my own.
I have to study alone, or else I will yap the entire time and not get anything done.
No, I'm a
Uh,
nanny. I keep everyone on task.
see, that's what I mean. You got to see what works for you. If you're a yapper like me, don't go to a study group because you would just talk the entire time. Oh my goodness.
Good to know.
But
Life-wise, because we talked a lot about education, is there
Mhm.
any sports that you like right now?
I'm sorry.
Are there any sports that you play or that you have time for?
I don't play currently, but I mean, in high school I played volleyball. I mean, I would play again, but like I just don't have the time for it. So I'm like, I just kind of pop in here and there, and that's it.
And then, do you also recommend? I don't know if you're even looking at applications right now,
Mhm.
but other people might be. Do you have like tips for what schools to apply to?
Um, I would really look at like the mission and values of the schools. Like if you see if it aligns with you and like whatever you include in personal statements, like from a medical school perspective, like because I already pre-decided all of the schools I'm applying for, even though I'm not applying this cycle, I'm applying next cycle starting this May. But I kind of like, well, I think it's May. I don't know. But um yeah, it's like you want to see the school, the values of the school, what kind of resources the school has for you, and like how accessible are those resources. Like if they have like a million students there and they have like two labs, I'm not applying there because like it's going to be impossible to get in and all of that. So I would consider those things: resources, accessibility to the resources. um Honestly, I would even look at location. Like, do you actually even want to be there? Like, originally I did have U Chicago on my list. Like, oh, I'm doing a research program there, and it's gonna be easier to get into. But I ended up hating Chicago. Um, no offense to anybody who might be from Chicago in here, but I just don't like the area, and it's really far from my family. So I was like, I don't really want to go there. So yeah, just don't apply to med schools that you actually don't want to go to because that's just a waste of your money. But or even just like other schools in general, like for undergrad, like don't apply to schools that you don't want to go to. Like if you don't like the area or anything, don't don't apply there because you're gonna be miserable and you're gonna be like, why did I ever come here? Blah blah blah. But yeah.
Where fun goes to die, that's the school
Um,
motto.
is it possible to like switch up your major during your college year? So for example, like can you start out with like something else and then later try out like pre-med again? Or like is
Yeah,
it
you
possible to
can.
like switch up?
It's definitely possible to switch. Like I mentioned before, like I technically applied here and committed here to be a criminal justice major, but then I switched over to pre-med. So it's definitely possible to switch. I know some schools are more finicky than others when it comes to that, so you just have to check in with your whatever college, like what are they called? Whatever office it is, just check in with them and be like, I want to switch. What's the process for that and whatever.
Yep.
Yeah, my school
Thank you.
required a year in your department and then you could switch.
See, that's crazy. I'm like, mm-mm.
Well, it's more so they didn't want people applying into an easier department and then just switching into the harder
Okay,
classes.
that
Uh,
makes a little sense.
Marianne did have a question that said, when trying to find shadowing opportunities, do you recommend going in person or sending in emails to local clinics?
Do both if you're able to. Emails, um, you really have to keep up with the emails like every 4 days. If they don't say something back to you, I would send a follow-up email. And if you're able to go in person, I would definitely go in person, print out like a million resumes with your contact information on it, and just start yapping with people and go from there. But yeah, I'd say both. Both is better than none of them. So yeah.
Recommend a resume and a cover letter.
I think the cover letter is doing too much. I just stick with just a resume. that lists any relevant experience and stuff. Like if you have any experience with like patient care, like doctors like to see that you've been in that setting. They're not really expecting you to like, oh, do you have like all this massive list of stuff, but they do want to see that like, oh, you're familiar with whatever you want to shadow and whatever. But yeah, that's kind of the my big take on that.
Well, I have time for one more question if someone else has a question. Throwing it out there before I ask a question. No, I think it's good. Have you taken your MCAT yet?
I haven't. I'm after I finish on my homework, I will start studying for it. But for now, I mean, I've done some UWorld review and like try to get familiar with the language of it. But
I was gonna
yeah,
ask what's gonna be your I was gonna ask either or depending on if you take it or not. What's your kind of study routine gonna look like? Are you gonna be more heavily regulated on like only doing UWorld questions? Are you gonna be book studies? Are you doing a program?
yeah, I'm just gonna be buying the AMC materials and doing UWorld and content review use Anki and kind of go from there. Just because like a lot of the med students who I've talked to who have scored like 520 plus, that was their exact plan. So I'm like, well, I'm gonna give it a shot because they got a good score and I want a good score. So I'm just gonna do it because I tried the textbook thing, did not work at all. I hated the textbooks and will never be reading another one ever again unless I desperately have to because the psych section might require me to read because I don't remember anything from that. Like I took psych when I was in high school and I don't remember anything.
Psych
So,
Soch, Anki will do you well with Psych Soch.
oh
I
yeah.
can guarantee you. If you can get through an entire Psych Soch at Anki, you're good.
Yeah.
Also highly recommend anyone listening or you for you, Mile Down review
Oh
sheets.
yeah.
There's also a guy on YouTube that goes through every single one of those sheets. The videos are like 4 hours long, but they're amazing.
Okay.
But
Do you remember the name of the guy?
I don't, but I can email him to you if you want.
Yeah, that'd be good.
And anyone else that wants it, I can email you stuff too. My email is really easy. It's just Kira and then at prehealthshadowing.com.
There you go.
If you guys have any questions. But I'm going to run through my closing little PowerPoint slides, let you guys know how you get your certificate, what else you need to do, and then I'll have it open a little bit for some questions at the end if you guys have questions for me, or I think Isabella's staying till the end as well. If you have any last minute questions that pop up and you want to ask her, you're more than welcome to. But for now, I'm going to open up this. So we talked a lot about applications applying to med school, and one of the big ones that Isabella highlighted was the having your personal statement and your activities written. And your activities, you write a lot on your experiences, how you feel about it, if it was meaningful, if it wasn't meaningful. I always recommend people reflect on these every session, every shadowing thing you do, each individual one as well. You make a little reflection. We have 3 questions here. It's what brought you to session today? What are your 3 major takeaways? What do you want to learn more about? You can always make up your own. I mean, I've been doing a few of these reflections myself, and I have my own questions that I like asking myself. And I do really love putting the what do you want to learn more about, because the next time I see my shadower or my session, I can always just ask that question since I have it written down, and it's easier when you've just done the session to write these little reflections. Also, if you wanted to share those, our LinkedIn has social media posts on there that also has these insights that people write or these little reviews. And so if you share us, we can on your post, we can always repost it. It's a great way to network. There are a lot of professionals that are on our LinkedIn and our socials that sometimes see these. So it's a great way to network and meet people. We also have just random health students that could help you out as well. Again, if you want to continue and you want to volunteer with us, you can be a part of our team. Our team are our volunteers. Those are two separate things. So if you want to register as a volunteer on our website, it's 100% remote. We're very flexible. You can do an hour a week. You could do 100 hours a week. I don't know anyone that does that, but maybe you're like spunky and you really want to do it. Especially those high schoolers. High schoolers are great that way. They have lots of energy. Again, if you want to donate, here's our QR code. We also have on our website, you can go and see what we're doing with those donations or what we're up to. You can also email us if you have any questions regarding donations or I don't know what you would need when regarding that. But if you can't donate money, even $1, I'm really stuck on this dollar concept. You can always donate your time and become a volunteer. I am always looking for more volunteers on live sessions or marketing. So if you have some great skills, I'm looking for you guys. So last but not least, thing that everyone always asks questions about, millions of questions. I get so many questions on this. You're gonna go to the page that you started this Zoom on, the professional page. You can also just go to prehealthshadowing.com and go to upcoming sessions, or I think Isabella's session is actually up on our homepage right now because it's within the time frame. You're just gonna go, you probably already signed up for the class. If you got the Zoom, I'd be surprised if you got the Zoom any other way. It's a free class. You just hit start, you navigate to the quiz. There's a couple different pages that you can go through. One of them is a reflection page. And then we are also going to link in a way for you guys to rate these sessions. We're always looking for ways to improve. It's really short, maybe takes you about a minute or two. If you take a long time to read, maybe it'll take you like 3 minutes. But you're going to take the quiz. It's 10 questions, multiple choice, true, false. Very rarely do we have multiple choice. They're usually single choice. Sorry. Getting over a cold. You have two. Sorry about that. You have 2 chances. Sorry. Choking on my spit, man. You have 2 chances to get a 70 or higher. These quizzes are open indefinitely. You can stay on it for as long as you want, but the quizzes are timed. You do still have 30 minutes to finish that single attempt, but you get 2 attempts. And then at the end, don't forget, you do have to click finish this course at the top to download your certificate. If you don't click that, sometimes there is a little browser pop-up. Don't forget to click the X on the top and then hit finish this course and you'll get your certificate. It'll have your name on it, any kind of contact information you may need. And if you, again, missed any part of this session, you can always go find this session. It'll be recorded on the same link tomorrow or maybe the next day. And then it'll also be uploaded to our Facebook page. And it'll also be uploaded to our YouTube page. And then you can go see the link for that and watch any sections that you missed, or maybe you missed a question and you want to get the answer for that. So we have another session coming up. It's not this one, but we do have another session coming up. All of our sessions are online, so you can always go see which ones are upcoming if you have time for any of them. If you're going to miss something, you can always register it so you can get the emails. Sometimes we have reschedules. We had one person reschedule towards the end of the month. And you're more than welcome to email if you need help with any of that. So thank you again and see you next time. If you have any questions, I'm going to stick around and answer any questions. I also have my student team with me, but we're more than happy to answer those.